Good evening, good evening, good evening. This is yours truly, Dr. Luvuyo Bayeni, and it is your host on DrBTalks. And yes, welcome to a special broadcast. Actually, yes, it's the first time we're doing a special broadcast. So yeah, nurses are special. We're doing a special broadcast, and it is because today it is the 12th of May, which is a day that has been given to commemorate, celebrate, embrace, but importantly, say thank you to the nurses. And the day is referred to as the International Day of Nursing, IDN. And we then opted to have this day as a special broadcast because I always tell people that I am a product of a nurse as a doctor. So there was no way I could let the day pass by without commemorating or doing something as DrBTalks. So yes, welcome, and thank you very much for those that have also tuned in. We know that we always say block and set timers for only Sundays, 1800 hours. But of course, because we had asked you to be available today, I know you made sure that you set your timers, your reminders, and your alarms and your calendars, and you are here today. And we thank you very much for that. We really do appreciate that you could make time for us and join this. Actually, a very interesting session because we are here to converse about nursing, but importantly, to share, appreciate, and share our experiences as nurses. And without wasting any further ado, I know she can't wait to introduce or say something. Welcome to DrBTalks. I know that you have been following us. You are always with us whenever we have our shows, and we really do appreciate that. And thank you very much for supporting us and making sure that we are able to always go and share a message of support, but also we are always able to have ideas on how we can improve on the show as well. Yes, thank you very much. And please don't forget, we are doing our simulcast broadcasting with Sowetan, and we do encourage everyone to continue to follow us on DrBTalks page as well as Sowetan. Yes, not only follow my personal Luvuyo Bayeni page, but please follow DrBTalks. Welcome to the show, Imana, and it's always a pleasure for you to be here and embracing us for today. I would not want to do any injustice when it comes to introducing you. I know that I met you at work doing your services as a nurse, and you have been following the DrB page, and we do appreciate that when we said we want to commemorate the International Nurses Day, you were available when we asked. So please, welcome to the show. This is DrBTalks family. So you are home. You are more than welcome to introduce yourself in any way you want to introduce yourself. But please, welcome to the show and introduce yourself to the viewers there.
Good evening, Dr. B. I always call you Dr. B.
Yes.
Thank you so much to Sowetan and everyone that made this possible this evening. I am Sister Professional Nurse Nirmala Chengalroyen. I have 3 names. So I have, the other one is Marlene. The other calling name at work is Sasha. I'll get to speak about that. Somebody at work gave me the name Sasha. So I have 3 names, and I actually go by the ID name, which is Nirmala. So thank you so much for having me here. I really don't know where should I start with myself, but I do follow your page and I celebrate you as well.
Thank you.
Without a doctor, I think in this healthcare system, we are one. Doctors and nurses, we are family. And thank you so much for having me here. I really, really appreciate this.
Thank you very much. Actually, I'm glad you mentioned the Sasha because that's the name that you were introduced by Izzy Kennan. Who's the big doctor that introduced us, Dr. Miss? What rank is he? Okay, yes. I don't want to use wrong names. Yes. Thank you very much, Tema, for joining as well. All right. Let's start with I like I said, I proudly and boldly say I'm a product of a nurse, and you rightfully have also shared that we are a team, and for a healthy, effective and successful healthcare system, we need to always embrace that there is what we refer to as a multidisciplinary team. And of course, that includes all of us in the healthcare space. Maybe let's start by a simple one, a very simple one. I always try and avoid this question when it's posed to me. What made you decide to choose nursing as a career, and what is nursing to you? A viewer that is out there, especially you do know that most of our viewers are also parents that are raising teenagers, and there could be those that are also having teenagers that are also in the mix of having to choose a career. So maybe that could also be helpful in terms of helping them make a decision in terms of which careers to choose. But what is nursing for you, and what made you to fall in love with nursing and to pursue nursing as a career?
Thank you, Dr. B. Let me just say this first. Happy International Day to all the beautiful nurses, the male, the female nurses. Thank you so much. This day you celebrated, and I know it's quite late now, but we still celebrate you, and we'll continue to celebrate you. So going back to your question, growing up in a small town in Durban, in Chatsworth, not having a lot of money and finances to pursue a career after matric. So I actually, by a neighbor, we found this article in the newspaper where they were saying that the Defense Force is taking intakes. So funny enough, on the application when I took it, I did not even choose the nursing category. So I selected the Army, the Navy, and all of the other sections. And under the health, I chose physiotherapy and occupational health. So I was not selected because of the scoring system. And when I came and I was taken for the intake and I came to Pretoria, when we had to divert into the smaller groups, and then they said to me, I'm selected for nursing. For me, nursing was like, oh my God, blood and all of this. I never actually wanted that. But the first year being a student nurse in nursing, I never ever regretted it. I saw myself as a healer just by going into a patient's room and being around a patient that was sick, and even a family member seeing you and they embracing you, having the hope that you could do something for them. I knew that I chose the right career. And for someone out there that wants to choose nursing, they always say nursing is a calling. For me, nursing is a choice. If you're in it, your heart has to be in it. You cannot do nursing without your heart. You cannot not have the compassion. You cannot not be passionate. You cannot not have the drive to want to heal another person and bring that person back into the community. So for me, nursing is not just a calling, as they say, but it's a choice. It starts within yourself. So if you have that capability and you have that belief system within yourself, and you want to see people healed, you want to see people come back and be put together, then I say go for nursing. Go for nursing. You are not just a nurse, you are a healer. The community needs you.
I think I like the fact that you are sharing, which is something that is very interesting, that at times, and it also talks to those that are in the space of choosing careers. I used to do a lot of matric outreach program in Somerset East when I was still in Eastern Cape. And one of the approaches I used to do when I advise on career choices is that first you must ask yourself, what would you like to do? But also in that field, in that space, look at what are the other different fields that talk to. If you say you want to be in the health space, what are the other fields that talk to that? So that even when you are preparing yourself in your mindset, it's not only fixated to one. And you are expressing exactly that as much as you had ideally would have loved to do physiotherapy, but this time around, because you were already in a space that says, I am going to be a health worker and I'm choosing a career in health, it was easy for you to say, now God has chosen me to come and do nursing, and you embrace it. But I like the other part you say, the minute you stepped into the wards and you saw the reaction, both emotional, physical, and even spiritual, from the clients that you were exposed to, even though you were still a nurse, because someone would have said, I was overwhelmed, but you saw that in actual fact, this profession of being a nurse has got this that it carries with. It makes people have hope. It makes people look towards being healthy, towards living, and towards going home and celebrating their life. So I think that's one issue that we are already embracing when it comes to the nursing as a profession, that it brings with that hope that when you walk into the ward in your white nursing uniform, but you're changing colors now, but it's fine. So, but it gives that hope, and that's what you personally experienced, and that's what had made you also to embrace the field and nursing as a career. Now I do know that maybe we also spoke about, you were in the Defense Force. You applied because there was an intake there. I think let's touch a bit there. As much as we're not here on it's not a career day. It's International Nursing Day. It's not a career day, but just to give a sentence to also express the other, especially health-related career opportunities, or how the Defense Force work, because people sometimes they look at the Defense Force as only being the part of the defense, which is the Army, and maybe others might know that there's the Navy and the Air Force. But just to maybe remind people that you are having a fully fledged health department. I almost say the health faculty, because that's how big you are. And maybe just remind people, when we talk of SAMS, what are we talking about?
Thank you, Dr. B. So yes, a core service within the South African National Defence Force is the South African Military Health Services.
Yes.
So you can see I'm actually portraying the military today. I'm in red. So we wear the red berets, and so it's a multidisciplinary team, just like how the national healthcare system has doctors, nurses, occupational therapists. Within the Defence Force or the South African Military Health Services, we have this core disciplines that functions within 3 different military hospitals around 3 provinces, which is the main one in Gauteng, the other one is Bloemfontein, and then we have one in Cape Town. So our main mandate is to serve the military community. However, when there's outbreaks, or when the national health, or when the nation needs
additional health
services, that's when we come in. But our core mandate is for the military and the community.
So that means that I hope my friend who is high up there at the defense will see that I also didn't leave them behind. So no, that just means that even those that are just looking at career options, you are more than welcome to also have an exposure and look at what is being offered there.
Yes.
Now they talk of your nightingales. They talk of the Cinderellas. They talk of, you've got all these fancy, beautiful names and tags that go with nursing. What would you say has been your relation to these prestige names that you are given? We know these days some other places even call it a Florence Nightingale Day, because of what the message behind the profession is. Would you like to share a bit about that?
Yeah, so definitely that's the foundation, the history of nursing, the legacy, the people that kept, or started the nursing. And one of the ladies is Florence Nightingale, the lady with the lamp. And just as I said, when you enter a room and where the patient is ill, you are seen as the light. You have come to heal. You have come to give hope. So I stand very strongly on that foundation to say that in today, if us as nurses carry that and stand on that foundation to say we are the light to the nation, we are the light to the people, I guess we can do so much. And not only nurses, the multidisciplinary team. In the healthcare system, we are so divided. We are so divided because of petty things like, professional jealousy, animosity, bitterness. But if we all embrace this foundation of saying that we are the light and assume we are, we can do so much better together.
So now you're explaining why, when you have got your graduations, even today, it's a pity I could not attend any commemoration today, but on your day you always have this symbol of the light.
Yes.
And I think that you have just put it very well, that is actually the foundation of nursing, to say when you walk into that room, when you come across someone who is ill or is in need of some healthcare services, as nurses, you are supposed to bring that light, bring that hope. And obviously, I think taking from what you're saying about the multidisciplinary approach, it's equally what I've learned in my experience as a clinician, that even in terms of just being in the workplace, nurses are the backbone of the healthcare system.
We are the skin.
So I know that that's the way it is, but I think that's, we even when I ventured into administration and governance in the healthcare space, one of the issues that we know for a fact that for a sound, stable governance in the healthcare sector, whether we say it or we don't, we know we always rely on nurses to say, if nurses stand together and give and support whatever vision is there of that institution, whatever vision is there for the healthcare system, it will thrive. But if we have nurses that are taking a back seat, that's when we don't. So I think it's a reminder, like you said, even in this day and era, the value, the role, the impact of nurses being the light is still being lived and seen even today. And we would like all the nurses out there to take cognizance of that, that we do need you to live that message, and also to leave that foundation of being the light. And I do know that you spoke about professional jealousy. There used to be a line that we get from the nurses when we come up as the young junior academic doctors, that, we are looking at them. Others will come here and will be like, no, we've never seen you at the medical school corridors. And we'll be like, no, it's fine. Let's wait and see if you are going to leave the corridors of Medunza when you are here. And you have to humble yourself and go back and say, sister, where can I find a needle? Where can I find, and this patient is difficult, how can I? So yes, you continue to help us and being the backbone when it comes to that. And I also want to tease you a bit, reflect on some of the memories and moments that both, sometimes you look back and you say, I went through that, and as a nurse, I am able to relate to it and say I am who I am now because of that nursing experience.
Wow.
And just make people understand that the profession also does contribute to who we have become. And how has it been for you when it comes to nursing and the person that you are?
Yes, beautiful question. Thank you. Are teasing me. So my journey as a nurse is 22 years. 22 years. I started 2004. It's been a journey of ups and downs. Most of my life being in the critical care, the ICU. I remember I got so used to one of the patients. I think he was like 90 days in the ward. And they always gave me, as a coming up as a ICU nurse, and you were not really given shift leading, but they would always give me this patient, and I used to work 7 in and 7 out. I got so used to him and his family, and when he passed away, they even called me the chief mourner. I cried so much. I cried, and that really showed, and really it actually made me realize that you become one. You become one with the people that you are always with, even with the patients that you don't know, strangers, you become one with them. So that was one of the episodes. And even at the funeral, I was like front stage. I was seen everywhere. I became one with the family. And until today, I'm still in contact with that family. Imagine how many years back. So my journey in nursing, as I have so many, I was the nurse to Mama Madigizela Mandela.
Oh, wow.
I stayed in her house from 2015 to 2018. When she passed away in 2018, I was at her bedside at Mill Park. So I have quite a journey that has made me grow in leadership, strengthen me in competency skills, strengthen me in the way I speak, strengthen my compassion for people. I know how to deal with people. I know people management. Nursing has really taught me people management.
Wow. So you bring now an interesting element to say it's not only about just coming to work to just render care, give medication, but it's an opportunity of finding yourself as a person.
Yes.
It's an opportunity of also getting to grow, develop, and it's an opportunity for being allowed to get to understand even your emotional being and your innate person. And I would stretch it a bit now, but I'll help you if you feel like Dr. P, this is too much. There's a lot of criticism. I'm trying to be polite in my choice of words. Where sometimes people will the first thing that comes to their mind when they might have had an experience that is negative will be, nurses' attitudes, or they would say, no, nurses are bad, and sometimes it obviously now would tend to maybe come in a bad way and be received in a bad way by those that are understanding nursing in the same way you said, that we come in not just to give medication, we give our all. So how would you probably share or encourage both us as the staff in terms of how we do things, if there is an area of improvement, but also as the clients that receive our service?
Yes.
How would you try and help us strike a balance? Because on one hand, it is also not as easy to ignore unfounded, negative, harsh criticism whilst you still want to focus on your work. But also, it does not exempt us from not doing the right thing or not showing compassion that you've mentioned, or not being seen to be caring, because we are saying people must just leave us alone. So how do we strike a balance and try and encourage both sides, from the client side, but also from us as the nursing professionals?
Yeah, it's quite a difficult one in today, in our healthcare system today. So I want us to focus on the theme a little bit of today, the International Nurses Day. Our nurses, our future. Empowered nurses save lives. So I want to focus on the clients, or let's say, not the nurses for now.
Let's start, yeah.
Yes. If we empower our nurses, right, I think we've forgotten our nurses. Our nurses are overlooked. Our nurses are underestimated. Our nurses are undervalued. And I think by taking that away from nurses, we have taken away the honor. You know, before, when there used to be strikes and all of that, a nurse was allowed to go to work. A nurse was even protected to go into the hospital, protected from the strikes. Now no one bothers about a nurse. You are just left. Nurses even have to take off their epaulets to get into a taxi so that they do not show their profession. So they are not embraced by the community. They are no longer embraced. So I think by that happening, or the gapping in that way, and the pressures that the nurses feel that the clientele has not received them. This is my
yes,
perception.
of course.
So
yes.
I'm just speaking from the heart now. You know, nurses feel like they are not honored. Let me tell you, I'm speaking also from my part. We don't feel like we are worthy enough for the service we are giving to the clientele. But also to the nurses, let me go back to them now. You know, nurses, if you only realize that what you have and the job and the profession that you are in, if you embrace it and search within yourself and forget the pressures and forget what the healthcare system is about and forget what the world is saying about you, but if you search deep within yourself and identify that this is the profession you want to be in, you will do it. You know, you will take nursing far, far, far. You will take nursing to the sky and above. So yes, there is that component of being nurses being ill-disciplined, you know, not professional. But it's a tricky one to say that nurses are under pressure. You know, the shortage of nurses in this country, though a nurse going to work expected to perform, expected to give the quality nursing care, but not having the actual resources to do it. How do you expect the nurse to perform?
Yeah, you turned this one on me. Yes, I must accept. Most my portfolio is about human resources for health.
Give us
and my pillar in the strategy is one of my pillars or goals is goal number 5 that talks about people management. Yes. And it talks about creating a conducive environment, which also talks to what you are saying in terms of resources, in terms of the environment being conducive. So yes, indeed, it's something that we really do want to put an effort and being intentional about it, that indeed we cannot just look at one side. We cannot just expect that as a nurse, come and give when we are not creating a conducive. Let's also look, one of our, she was also here at DrBTalks. I see that she was also commemorating her day. Pilela wrote today to say, to care for others is more than a profession, it is a calling. On this International Nurses Day, I celebrate the strength, compassion, patience, and dedication that nurses carry every single day. Proud to wear this title, proud to serve, and proud to make a difference. Thank you very much, Pilela, for that. And we also hope that you did enjoy your day, because she posted this 7 hours ago, and indeed it is a day to celebrate. And I think it's just an emphasis that nurses do know that their foundation is on patience, is on compassion, is on dedication. And what you've just mentioned now, that we sometimes are pushing them a bit far when we don't support them, when we don't have resources that we want to share with them and avail for them. So I think I do relate to what you're saying, that it sometimes does contribute in terms of that. But I think the message that we want to send out there is that indeed, as much as people might be having some form of a experience that was untoward, we should not take it as a message that says nursing, especially the foundations of nursing, have now been have evaporated or have now been changed. As you've just heard now, a nurse woke up this morning, motivated herself because she knows why she is a nurse. She's proud, and she wrote that. So I think that's one thing that we would like to share and raise with people, that is what we expect from an understanding and embracing the profession of nursing. But of course, I also want, so that we're not seen as if we are looking at the gloomy side and whatever, you would also share a couple of moments where you did not have to be on the front seat as a VIP chief mourner, but also where people come back and say, I'm celebrating my birthday today because of a nurse.
Yes.
Because we also have those where people will feel and say that, as much as I'm celebrating my day, in actual fact, I remember those nurses that were in that ward. And if it were not for them, I would not be celebrating my birthday. Share a bit of those moments that also you get to even sometimes meet people that you might not even remember that they were my patients, but they want to support, appreciate, and embrace you and say, thank you, and thank you.
Yes, that's true. We had many, especially in the ICU, especially when I also did my practicals in Steve Biko Hospital. Public hospitals, I think because of the overload in the workload, it seems like families embrace those nurses more than the military nurses. So yes, we do have that, after many years, and it's so beautiful to see the patient come back. And as you said, we don't remember even the patient. You would even have to tell you the history. I was admitted where, and just to embrace the patient, them coming and giving us gifts and just being with us. That moment to see the patient walk out again, it's like, wow, we've done something. It's worth it.
And I think to all the nurses out there, and today this is what it's all about: to celebrate, to appreciate, to embrace you, but importantly to remind you that you are still on the right path, and you still are giving and honoring lives that you serve in the manner in which you do. And we do want to also take note that when we celebrate the Nurses Day, it's just one of those days that even those that might have been discouraged or maybe feeling worn out or feeling a bit down and questioning, why am I in this profession? Even those that are currently at work, maybe now going through some difficult challenges. Today, it's about saying, we see you.
Yes.
You are not alone. And importantly, we value you more than anything else. And we would like you to continue doing what you're doing. Please continue to drop some messages, comments on the comment section. This is your show as well. Please share with us what has been your lovely experiences with the nurses, or please share with us what has been your experience with the nursing profession. We are only left with 15 minutes. It was a special broadcast, so we would like to also make sure that we don't leave out any of your comments that we would like to share with the audience, and also for you to be able to have a moment to say, this is what I would like to raise. And maybe just to also share from my journey as well in terms of the nurses. I did say that I'm a product of a nurse.
So you say nurses are feisty.
I'm a product of a nurse. You know, in my clinical rotation, when I did internship, I was the last group of 1 year internship, and in my rotation in Kimberley Hospital, I then had to do 4 months of obstetrics and gynae, and then I did 4 months of internal medicine, which had 1 month of anesthesia. Now I'm left with another 4 months. This other 4 months was divided into a surgical rotation, which was 2 months orthopedics and 2 months urology. So it means I did not get to be rotating in pediatrics when I was an intern. And you can now imagine I come here as a community service doctor, and everyone is like, now you are independent now. Yeah, and the journey for me was made simpler, easier, and very much memorable by a nurse. Because we get there, you know that the nurses have been here, they've been running this pediatric unit, and you try again and use your social skills to say, I'm waiting on you to lead me here. Because you also don't want to take a risk and pretend as if you know it all. And I knew my limitations, that I have been out of school for a full 12 months. And in that 12 months, I've never rotated in pediatrics. So I needed to know that I've got limitations. But because of the nurses that embraced me, this was at Andrews Vosloo Hospital in Somerset East. We had pediatric nurses there. One of them now is the matron there that received me in pediatrics, Lorraine. Thank you very much for that guidance. And so when I say I'm a product of a nurse, it's because of I know that you are able to hold our hands. And I think maybe it's something that we don't say it out loud, and we don't say it as much as we need to, that we become the doctors that we are, because a nurse had to hold your hand, a nurse was there to support, to guide, and also correct you.
Yes.
Say, can I talk to you at the side? So that's what we want to embrace as well, that we are product of nurses, and if it were not for nurses, we would not have all this prestige and famous and renowned doctors, because without a nurse, we would not be there. So I do know that you also have a few doctors that you had to hold their hands, but we won't mention them here. It's fine. They must talk for themselves and speak for themselves. But yeah, as we are moving towards closure, we're left with now 10 minutes. I know time flies, especially when it's here with Dr. B. It seems as if someone multiplies the pace of the time and wants us to finish before, and yet we are still enjoying. What elements of nursing would you like us to also raise and share? What guides nursing? I know you've also mentioned that you have also grown into governance, into leadership through your journey as a nurse. How would you support people out there in terms of embracing that. Before we miss this one, CM Tanda is also saying that it's a highly noble profession. The cornerstone of any health facility, it is the nursing staff. Thank you very much, and we are here to celebrate them. And I hope as well that your own colleagues are able to understand that we appreciate them and we value them and we rely and work very closely with them as the healthcare system. Thank you very much for that. So just before we maybe miss, on your part of the governance and the leadership, and from the nurses' point of view now, what would you say are your support system? Are there strategies in nursing, and what helps you now to stand firm and say, I am pursuing this leadership and governance approach when it comes to nursing?
For me, so I think my experience overall, I love speaking so much, and I think it's I just love speaking, and I want to be a voice to see change. So yes, there is nursing strategies. There's a new one that came up in 2021, 2022, 2025, 2026. Beautiful things on paper, beautiful policies on paper, but there is no implementation. We have gaps in implementation. So me coming into the platform now, or into the dimension of strategy and governance, for me, my heart desire is to see implementation, putting words into action. And I think it is time for us to do that. And one of the components in this year's theme is empowered nurses saves lives. To the nurses out there, I want to say to you, do not wait for someone else to empower you. Empower yourselves. Do the short courses. Go to the internet, the AI courses, any short things, courses that you need to even pay a 500 Rand fee. I do those things. I've been doing it for the past 22 years. Those short courses have helped me to become the person I am today. If you sit being unempowered, sit waiting for a government to come and take you into a place where you need to be, no one's going to come and save you. So for you to fulfill the theme of this year, empowered nurses save lives, for you to save a life, empower yourself. Become better than what you are today.
Thank you very much. That is simplifying and trying to express the theme of this year's International Nurses Day. And I was waiting to make sure that we also remind and share with our viewers that indeed also the National Department of Health had commemorated the day and was hosted. It's not because I'm from there, but was hosted by Eastern Cape. National was hosted by Eastern Cape in collaboration with DINOSA, which is the organization that is leading the nurses. And I just thought maybe I'll also close off and share that some of the issues that you raised earlier on are also being noted. There is a line there that was mentioned at the commemoration by the minister, where it says that there was an emphasis on the importance of empowering nurses through improved working conditions and safe environment to maximize their life-saving impact, not only in a facility, but globally. So it talks to what you were saying, that if we could try and make effort to improve the issues that deal with the service and the environment thereof. It also goes further to say that the department's efforts focus on providing accessible healthcare services, promoting healthy lifestyles, and they have been actively engaging with the public through other programs, but the nurses are at the forefront of ensuring that. So I just thought, let's also share that as we are seated here, we are, and I deliberately did not want us to talk and start with what the department, because the whole purpose here at DrBTalks is to say, you have lived the experience. Share with us, share with the viewers what has been your experience. And I think it's also so profound that even from the angle of the actual ministerial celebrations or commemoration, the issues that you raised as a person that has lived the profession are also getting to be elevated at that level. So we really do appreciate that you were also genuine and you were expressing yourself without buying my face. But yeah, we also appreciate that, and we do value that you honored and came here. It is now exactly 19:10. Yes, there is Vuyiswa Shwana coming in to say a very important raise by sister, nurses must empower themselves.
Yes.
Just what you said. that as an individual, and I think it also talks to what you said as an experience. You said through the nursing profession, you have grown as an individual.
Yes.
There are elements in your life that now you know have been embraced by a profession. She's a very religious person, but yeah, we want to talk about that. She's going to host some event, and we're not going to talk. So you mentioned that.
But you agree, right? You know me from a young nurse, right?
Yes, for sure. And like I'm saying, I appreciate that you were able to also express, which is a message that maybe we would also like nurses out there to look at. Whether you have been in the profession for too long or you are coming into the profession as an entrant, to say that at least make sure that you are able to understand that the profession can contribute to your different elements of your life.
Yes.
And you need to embrace that this is an opportunity that can make you another person, can make you a better person. So nurses out there, we see you.
Yes.
We embrace you.
Yes.
We support you.
Yes.
And we would like you to be better at what you are, both as a person or as a professional. But importantly, go back to embracing the foundation and the principles and the pillars of nursing. Let's make sure that when we walk into a room as nurses, we are giving hope, we are the light, and people can see that by me being here in front of a nurse, all the doubts I had about what's going to happen to me are now would just vanish, and I will be hopeful and look forward to. What will be your closing remarks? I know time is not on our side. I wish I could just pause. It's 1912 now. We had said we are going to end at 1930. So yeah, I know the team at the background is also going to be sending me some harsh reminders that yes, but we do appreciate your time and would like you to also have some closing remarks and share how you would like this day to be remembered and the profession as well.
Thank you so much, Dr. B, for having me. I feel like giving you a hug. You need a hug.
That's a lesson you.
Yes.
No, this is just like to give hugs.
I just want to hug you so much and just say thank you for this opportunity. Thank you for having me, to your team, the beautiful listeners, my family, the ministers from church, my beautiful spiritual fathers, my mothers. You know, you said, yeah, I'm very spiritual. So, you know, the support system, the nation. So what I want to just leave behind and have a plea to the community, a plea to the nation of South Africa. Don't forget our nurses. You know, look at our nurses from today in a different light. And nurses, look at yourselves from today in a different light. It is time you take your positions. It is time you take your place as the beings that you are created to be, the light, as the doctor has said. And one thing I want to say to you, they have never had doctors' days. They have never celebrated doctors. You are so fortunate enough to have had this day to celebrate nurses. And also to the community, don't just celebrate nurses on International Nurses Day, which is 12th of May. Celebrate them going on. I have a plea to the nation of South Africa. Pray for nurses. Nurses have become vulnerable. They are the vulnerable taking care of the vulnerable. So the caregivers need care. My plea is hold them up in prayer, support them, love them, and they will give you back the love that you desire and need. Empowered nurses saves lives. Thank you.
You know the way you ended, I'm only supposed to say amen and not talk. Yeah, I would not dilute any of that. Let's care for the carers. Let's keep them in our prayers. And the part that I had not shared, and I think I've never shared it before, is that when I say I'm a product of a nurse, I also have happened to, in my family, I've got an aunt. She's retired now. Is a professional nurse. She used to be an ICU nurse. And I also have my other aunt who has also retired. She is a registered nurse.
Wow.
And it so happens that my first niece from my elder sister is a nurse, professional nurse. And as well as my cousin from one of my aunts is also a nurse.
And
So I am in a family of 4 nurses. So yes.
I pray that you marry a nurse.
Oh!
I pray you marry a
No, I
nurse.
already have a lot of nurses in my family. And yeah, actually speaking of that, my cousin Tuma is married to a nurse. So that makes 5 nurses in the family now.
Wow.
So yeah, we are a family of nurses, and this morning I also had to start with them and say thank you very much to them. And I also appreciate that they also bring that care, that love, and that passion as we bring up, as we grow together as a family. So we do appreciate that influence of the nursing even in our upbringing. Thank you very much. That is it. It is now exactly 19:16, and we have been with you for exactly 45 minutes, which is what I had asked for. And we would not keep you any longer. But importantly, let's continue to celebrate nurses every day. And yes, now you're making me jealous that we must make sure that there is a Doctor's Day, but we always wear different color socks and whatever. That's how we celebrate. But yeah, we would also learn from the nurses, but we are always proud to be part of the Nursing Day. Because we are a product of nurses. That is it from Dr. Luvuyo Bayeni, your host for DrBTalks, and as well as from our partners, Sowetan. It has been a pleasure, and we do embrace this day of International Nurses Day. Continue to follow us on our Facebook page, DrBTalks, YouTube channel, DrBTalks, as well as Sowetan on both the YouTube as well as the Facebook page as well. And we are going to see you on Sunday as we continue with our theme for the month, which is physical health, exercise, and sport. And we are hosting, you are going to see the poster tomorrow. Let me not spoil things. And we are going to be hosting one I almost said a prestigious healthcare workers when it comes to the sports and medicine space. So thank you very much. We'll see you on Sunday, 1800 hours. And thank you very much. That's it from DrBTalks. Have a lovely evening and the rest of the week.